Who could have possibly seen this coming?
And in response to the worsening trends and existing challenges for our healthcare system, I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings. I'm also recommending that, if possible, children between 2 and 5 wear a mask with supervision if they can tolerate the mask and safely put it on and off.
Welcome everyone to Ratioed. My name is Harrison Faulkner. Time to dust off the old muzzle. Masks are coming back. And for the time being, our public health officials, those paragons of medical excellence, well, right now they're just recommending a return to masks. But you just know that the government mandate, the government order to cover your mouth with a piece of cloth is just around the corner. We know this because the legacy media is pushing their fear-mongering, mask, paranoia propaganda on all of us. It is going into overdrive. Drop a like on the video, subscribe to the True North YouTube channel, and the common question for the episode is this: when the inevitable mask mandate drops, when the government tells you to be a good, subservient citizen, will you obey? Will you follow the government order to mask up? All right, let's get into it. The COVID zealots, the politicians, the public health experts, and the fear-mongering TV doctors could feel their grip on our freedoms slipping through their fingers. They knew that too many Canadians were starting to realize that muzzling themselves, covering their face with a piece of cloth for a virus that has a 99.9% survival rate just didn't make any sense. So what do they do instead? What they're now telling us is to cover up our faces with a mask for the flu. I guess we have to chalk it up as yet another victory for those conspiracy theorists who all told us that these public health measures, these masks, weren't going anywhere. They were going to try and keep them on us for as long as possible. Sure enough, it looks exactly like what's going on. Here's what Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, had to say today.
And in response to the worsening trends and existing challenges for our healthcare system, I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings, especially around our most vulnerable Ontarians, the very young and the very old. I'm also recommending that, if possible, children between 2 and 5 wear a mask with supervision if they can tolerate the mask and safely put it on and off.
And just last week, Canada's Chief Public Health Officer, Dr. Theresa Tam, told Canadians that in order to protect yourself against the flu and other respiratory illnesses, masking is recommended along with your vaccines and along with the other suite of COVID public health measures. So just like that, with COVID cases stagnant, with COVID deaths around the world dropping by over 90%, it's time to use the COVID health measures to protect against the flu, because science, right? How dare we question the science?
Of course, like as usual, we recommend using masks as a layer of protection, but it's up to the provincial authorities to decide what they might do in their own context.
When we're having this conversation about masks, about masking up for the flu because of science, of course, it's important to remember what doctors like Theresa Tam were telling Canadians in March of 2020, at the beginning of the pandemic. This is what Dr. Tam told Canadians at the end of March in 2020 about wearing masks if you're asymptomatic or not infected with COVID, i.e. if you are trying to protect against the flu.
Putting a mask on an asymptomatic person is not beneficial, obviously, if you're not infected.
There you go. Dr. Tam said in March 30th, 2020 that wearing masks when you're not infected with the virus is obviously not beneficial. Those were her words. And now all of a sudden, we have public health experts, Dr. Kieran Moore in Ontario, Dr. Theresa Tam, and you just know the rest of them are going to come out across the country telling us that it's time to bring back masks. We know this because the legacy media is pushing this like crazy. The pro-mask propaganda and the fear porn is off the charts. It's like we've gone back in time. It's like we're back in 2021. Legacy media telling us we need to be petrified. Legacy media telling us we need to stay home to protect grandma. That's basically what's going on here. Take a look at some of these legacy media headlines. This is from the CBC. Canada is seeing an early rise in flu cases. Is a tidal wave of infection coming? Here's another one from the CBC. Wear masks indoors, Ontario doctors urge ahead of perfect storm in pediatric system. This one is from CTV News. Canadian healthcare system struggling amid multi-demic of flu, COVID-19, and RSV. This one is from Global News. Doctor urges Canadians to avoid getting infected and mask up amid viral surge. Now take a look at this CTV News Ottawa tweet. It just says mask up. That's the tweet. That's literally the tweet. That's all it is. That's the headline of the CTV news piece. Mask up. What great journalism. How objective. How hard-hitting, guys. Mask up. What a headline there. Well, it turns out that if you watch the interview, you'll realize that in their zeal to mask us, in their effort to take our freedoms away, they sometimes let the truth slip. Watch this. This is an interview with a CTV News Ottawa anchor and Dr. Vera Etches, the Chief Public Health Officer of the City of Ottawa. The beginning of the interview starts with Dr. Etches calling for a return to mandatory masking, calling for a return to the mask mandate.
This is only a recommendation from public health. Should the province be bringing back a mask mandate?
Well, I've written, and our Board of Health has just written to the Premier, the Minister of Health, and our Chief Medical Officer of Health, asking that it become clearer and through sharing of data, through a strong campaign, that now is the time to return to mask wearing, a well-fitted mask indoors in any setting where it's crowded and you can't distance.
So there you go. She's calling for the province to implement a mask mandate because there's a sharp rise in virus spread in the RSV virus and these other respiratory illnesses. And then a CTV News anchor asks the doctor why we're seeing a sharp uptick in respiratory illnesses in children. And this is what the doctor says.
Why is it that the little ones are getting so sick right now? Some people are assuming, well, it's because they don't have the COVID vaccine or many COVID vaccines yet. They're so young. Is that the case or is it something else?
Well, I do recommend that young children have their COVID vaccine. It prevents hospitalization. That is clear. It's a safe vaccine and there aren't as high rates in children. But it's really not just COVID here that's happening. It's the respiratory syncytial virus that's putting particular pressure on young populations. And that is a virus that typically it circulates in our community. People are exposed to it over and over again and they build immunity. But our mask wearing has stopped viruses over the last couple of years. And so people haven't built up the same amount of immunity in their young years to these viruses.
You see the logic there, the non-existent logic? That we have to wear masks to stop the spread of respiratory illnesses, and that wearing masks has lowered our immunity and lowered children's immunity to these respiratory illnesses? Oh, perfect. So we're going to force kids to wear masks in classrooms. We're going to force all of us to bring back mask mandates and muzzle ourselves so we can suppress our immunity so that we can always have these RSV cases circling around. That's when these doctors let the truth slip. They let the truth slip when they're not paying attention, and they inadvertently tell us the truth. So there you go. Dr. Vera Etches tells us that children have a suppressed immunity because of mask wearing, and that's why they're getting hit with RSV so hard. So then what does the CBC do? Well, take a look what the CBC does, Trudeau's propaganda outlet. The CBC writes an article titled, "These Ontario Parents Want Province to Make Masks Mandatory in Classrooms Again." And you got these parents here who are threatening legal action against the province if they don't force masks on children in classrooms. So we're living in complete clown world here. So you got a group of parents threatening legal action against the province if they don't force masks on children. And then you've got a Ottawa chief doctor going on TV telling us all that we need to return to masking, but also saying in the same interview that because children have been wearing masks, their immune systems have been suppressed, and that's why they're getting hit with RSV. How does this make any sense? Well, I think the truth is, really, it's not about making sense. It's not about health. It's about keeping us muzzled. It's about forcing you to wear a mask. It's about forcing you to listen to public health guidelines because you can't question the science. Something very interesting is happening with public opinion as well. You see, you've got legacy media teaming up with professional polling firms like Nanos Research and Forum Research to try and tell all Canadians that actually the majority of Canadians, over 50% of Canadians, in some cases over 70% of Canadians, would support a return to masking, would support a mask mandate on Canadians. I wonder why the legacy media, bought and paid for by the Trudeau government, bought off to basically propagandize on their behalf, are now trying to convince Canadians that actually all of us are in support of a return to masking. All of us are in support of a return to masking, not for COVID, but for the flu, but for the surge in viruses, as they creatively lead with their headlines. So take a look at this. This is a Nanos Research poll paid for by, wait for it,
CTV News.
That tells us that actually 70% of Canadians would support a return to masking, would support a mask mandate. The question for the poll is this: would you support somewhat support, somewhat oppose, or oppose a return to mandatory wearing of face masks in indoor public places this fall if authorities deem it necessary due to rising COVID case numbers. It turns out that the Nanos research poll says that 52% of Canadians would support and 17% would somewhat support a return to masking. So there you go. The Nanos Research Legacy Media paid for poll says that 70% of Canadians would support a mandatory return to masking. How convenient for the Legacy Media, and also how convenient for the public health officials now trying to push masking at this exact time for the flu. Not for COVID, but for the flu. Not to be outdone, of course, would be the Toronto Star, another bought and paid for legacy media outlet that the Trudeau government funnels cash to propagandize on their behalf. So Forum Research conducted their poll, paid for by the Toronto Star, to ask Ontarians if they would support a return to mandatory masking. The question in the Forum Research poll is this: do you agree or disagree that the province of Ontario should bring back its mask mandate? 53% of respondents said they would support a return to mandatory masks. If you go outside, do you see 70% of the people you walk past in indoor settings wearing masks? Because you would think, actually, that if the majority of Ontarians, and the majority of Canadians, it turns out, from Nanos Research, would support a return to masking with respiratory illnesses so high, with the legacy media telling us that flu and RSV are so dangerous, you would think you'd start to see masks everywhere. But you don't. It's not like polling companies have ever gotten anything wrong before, right? And to prove to all Canadians just how important and critical masks are for our health, just to show real leadership by leading by example, Justin Trudeau, our dear leader, well, this is what he did last week when walking into a pharmacy to get his flu shot and to get his COVID booster.
I'll take some Tylenol before going to bed. That's been my trick so far.
That's it.
All right?
It was a pleasure meeting you, sir.
It was a pleasure. Thank you so much for all your work. Really appreciate it.
Thank you, sir. Thank you.
So I'm really happy to have gotten my booster shot for COVID today. It's really important that we all keep up to date as the weather's getting colder, as we know flu season's kicking in.
All right, everyone, that's going to do it for us. Thank you so much for watching. I'll catch you on Thursday. My name is Harrison Faulkner, and this is Ratio.